आप इधर से अपना माइक बंद कर लीजिए फोन से।
Assalamu alaikum and welcome into 14th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceuticals. We are into the 14th match, that is between Saidu Royals versus 𝐏𝐚𝐤𝐬𝐻 Hospital 𝐏𝐸𝐬𝐬 Protectors. It is second match of Group E, and we already know, according to the format, it's again a knockout match. Only one top team from each group will move to Super 6 stage. Today, we are blessed with the kind presence of Professor Ishaq Saab. He is Patron-in-Chief of Cardiometabolic Premier League and Professor of Cardiology at KIHD Karachi. Along with him, we have with us, for umpiring purpose, Professor Azizur Rahman Saab. He is Professor of Medicine and is Senior Vice President of PSIM. For moderation purposes, we have with us Assistant Professor of Cardiac Electrophysiology, Dr. Qurban Hussain Khan Saab from RIC Rawalpindi. For further moderation, over to Dr. Qurban.
Thank you very much for that kind introduction, Usman Saab. Well, here we are. It's Group E, it's the second match and the 14th match overall. We've had some wonderful contests, 36 teams whittled down to a Super 6, and today we've got probably a very, very fierce competition. We've got two wonderful teams from Swat Mingora, Saidu Royals, and from Rahim Yar Khan, 𝐏𝐚𝐤𝐬𝐻 Hospital RYK Protectors. We have our umpire today, Professor Azizur Rahman, to deal with any disputes. And we also have our patron-in-chief, Professor Muhammad Ishaq Saab. So great to have him on board and carrying on with his blessing as well. So here we are. We're ready for this competition. This is the Cardiometabolic Premier League, powered by Wilson's Pharmaceuticals in association with the Pakistan Society of Internal Medicine and the Pakistan Hypertension League. Looking forward to a wonderful contest today. So without any further ado, let's get to the two teams. Let's start with the Saidu Royals, please. Assalamu alaikum, Saidu Royals. Welcome to this match.
Ji, walaikum salam.
Can the captain
Thank
of
you,
the
Ji.
team please introduce themselves and their team members?
जी मेरा नाम करीमुल्लाह है और मैं फोर्थ ईयर इंटरनल मेडिसिन का पीजीआर हूँ सैदू ग्रुप ऑफ टीचिंग हॉस्पिटल स्वात में। और मेरे साथ डॉक्टर जीशान है, इंटरनल मेडिसिन का पीजीआर है सेकंड ईयर का। इसके साथ डॉक्टर इसरार साहब है, ये भी फोर्थ ईयर का पोस्ट ग्रेजुएट ट्रेनी है। और इसके साथ वजीउर रहमान है हमारे पास, वो भी सेकंड ईयर का ट्रेनी है हमारे साथ जी।
Wish you the best of luck. Good luck in this competition.
Thank you.
And now we go on to 𝐏𝐚𝐤𝐬𝐬 𝐡 Hospital. Can the captain of the team introduce themselves and the members of their team, please?
अस्सलाम वालेकुम।
Walaikum
मेरा
salam.
नाम डॉक्टर मोइन है। मैं फोर्थ ईयर का पोस्ट ग्रेजुएट रेजिडेंट हूँ इंटरनल मेडिसिन में। मेरे साथ डॉक्टर साद हैं, ये थर्ड ईयर रेजिडेंट है मेडिसिन में। मेरे साथ डॉक्टर शफीक अकबर साहब हैं, ये भी फोर्थ ईयर रेजिडेंट हैं। डॉक्टर सनाउल्लाह साहब हैं, ये भी इंटरनल मेडिसिन के फोर्थ ईयर रेजिडेंट हैं। और साथ में डॉक्टर that's it.
Wish you all the best of luck. Wonderful teams, mashallah. So, what are the rules of the game? Well, the
Thank
rules
you.
of the game are that there is a coin toss at the beginning, an electronic coin toss, and the winner of that coin toss gets to decide whether they ask questions or whether they answer questions. Now, what format are the questions? Well, there's a clinical vignette, a case history, and then there is a series of multiple choice questions. Initially 10 multiple choice questions, and that can go up depending on whether there's a tie, and then we can go into sudden death. And each multiple choice question has usually 4 or 5 options. You get 6 points for a correct answer and 0 points for an incorrect answer. Let's go on to our coin toss now. I nominate Saidu Royals. They will be the first to decide on the coin. So, Saidu Royals, I want you to pick either heads or tails. We're going to roll the electronic coin toss. So the captain will decide heads or tails. So
Heads.
All right, you've chosen heads. Let's roll that coin. And the winner is tails. So that's fine. A bit of a shaky start there, Saidu Royals, but you can win despite that. Let's move on to 𝐏𝐚𝐤𝐬𝐬 𝐡 Hospital. 𝐡 Hospital, are you there? You've won the coin toss by default because your opposition picked the wrong side of the coin. So do you want to answer questions first or ask questions first?
Ask questions first.
You want to ask questions first. Fine. So you want to chase. Let's see how that goes for you. Wish you the best of luck. So let's move on to
Thank you.
you're going to decide which of the cases you're going to ask. So, Sheikh Zaid, do you want to ask question? Your opposition will start by answering questions. Do you want them to answer case A or case B? Choose.
Case B.
All right, your opposition will be answering case B, so by default you'll be answering case A. Let's get on to case B now. And can you read out the case history, please? Sheikh Zaid.
A 56-year-old man with a 15-year history of type 2 diabetes mellitus presents for routine follow-up. He has been he talking लिखा रहा है ना यहाँ पे सामने, इसको चेंज कर दो. He has been experiencing mild bilateral ankle swelling for 2 months. He has no shortness of breath, chest pain, or urinary symptoms. His medications include metformin, atorvastatin, and amlodipine. His blood pressure is 148 by 92 millimeter of mercury. Lab results shows HbA1c is 7.4%, serum creatinine is 1.4 milligram per deciliter, eGFR is 58, urine analysis is 2 plus protein with no hematuria. Urine albumin to creatinine ratio is 420 milligram, and fundus examination is non-proliferative diabetic retinopathy.
Okay, so the serum creatinine is 1.4 milligram per deciliter, but the baseline was 1.0 6 months ago. The urine albumin to creatinine ratio is 420 milligrams per gram. So that sort of clarified some of that. can we go on to Rahimia? Can we go on to Saidu Royals, please? Have Saidu Royals. Saidu Royals, did you understand that case history?
Yes, yes.
Excellent. Now, Rahim Yar Khan, Sheikh Zayed are going to ask you questions on this case. So,
Okay.
Rahim Yar Khan, are you ready?
Yes, we are ready.
Okay, let's have question 1 on the board. Read it out, please.
Which stage of diabetic retinopathy is most consistent with the above findings?
Which state of diabetic nephropathy is most consistent with the above findings? A, hyperfiltration stage. B, microalbuminuria stage. C, macroalbuminuria stage. D, end-stage renal disease. E, normoalbuminuric nephropathy. Your clock starts now, Saidu Royals.
Options. 420, 300. Option C.
Option C, macroalbuminuria stage.
Is that the opinion of all of you? Do you all agree?
Yes.
Okay, very certain, very sure-footed. Let's lock in that option. Option C. Are they right? Are they right? Yes, they're right. A magnificent start. Brilliant. Confident on the front foot, driving through extra cover for a 6 because it goes over the boundary line. So 6 points on the board. Well done, Saidu Royals. Very, very well done. Smartly done. Let's move on to question number 2. Read it out, Rahim Yar Khan. And the options as well.
Which of the following is the most appropriate next step in managing his kidney disease? I can't read the options.
Read the options, please.
Options are not clear here.
Okay, I'll read out the options. So which of the following is the next most appropriate step in managing his kidney disease? Option A, start sodium bicarbonate. Option B, refer for immediate dialysis. Option C, add an ACE inhibitor or ARB. Option D is stop metformin. Option E, start a loop diuretic. Your clock starts now.
Option C, add NAC inhibitors or ARB.
Okay, that's fine. That's decisive. Are you sure? You've got 47 seconds.
Yes, yes, we are sure.
Okay, they are sure. Let's lock in option C. Add an ACE inhibitor ARB. Are they right? Are they right? Yes, they're right. They're tested by the fast bowler and he bowls right at their body. A very, very high bouncer and they hook it. It goes in the air, but it misses the fielder. It goes behind the wicketkeeper and behind the boundary rope for 6 runs. So 12 out of 12. Saidu Royals really cranking up the heat. Real pressure now. Let's move on to question number 3.
Which of the following indicates diabetic nephropathy rather than another glomerular disease? Option A is rapid rise in creatinine over days. Option B is active urinary sediment with red cell cost. Option C is long-standing retinopathy. Option D, absence of albuminuria. And option E, sudden onset nephrotic syndrome.
There are your options. Take your time. Our seniors always say, take your time, discuss all the options, look at what the possible correct answers could be.
Nephrotic syndrome.
Which the following indicates diabetic nephropathy indicate की लगा और stick तो सही है.
Option C, long-standing retinopathy.
Okay, option C. So you had to think about that. Did you discuss it? Are you all agreed on this?
Yes, we are agree.
Okay, sounds a little unsure, but we'll lock it in. Option C, let's lock that in. Lock. Again, magnificent Awesome. Brilliant. So the opposition player spinner, the spinner bowls, and he bowls it short, and you pull it away on the onside boundary for another 6. So a hat trick of 6s. Great, great job by Saidu Royals. So 18 out of 18. Perfect score so far. Let's see if they can carry on this trend. Question number 4.
What is the primary mechanism of renal damage in diabetic nephropathy? Again, I can read the options. Not clear here.
Okay, option A is immune complex deposition. The primary mechanism, the question is the primary mechanism of renal damage in diabetic nephropathy. Option A is immune complex deposition. Option B is podocyte loss and glomerular basement membrane thickening. Option C is amyloid deposition. Option D is cholesterol emboli. Option E is mesangial immunoglobulin A deposition. Start the clock.
Option B, podocyte loss and glomerular basement membrane thickening.
Very, very certain, very, very decisive. Do you all agree on this option?
Yes, agree.
Okay, everyone's nodding their head. That's fine. Let's lock it in. Option B, are they right? Yes! They charged down the track.
Hamza, what a wonderful performance so far. Very exciting, very interesting.
Definitely, sir. Definitely. Very, very confident by Saidu Royals. They seem to have a good grip on this subject. And I hope that they can carry on in this vein. Wonderful. Let's move on to question number 5. Rahim Yar Khan, please read it out.
What is the blood pressure target for this patient according to most current guideline referenced in Harrison? Option A is 160 by 100, option B is 150 by 90, option C is 140 by 90, and option D is 130 by 80, and E is 120 by 70.
Start the clock. You've got 5 blood pressures to look at.
Option D, less than 130 by 80.
All right. Are you all agreed on that? You've got plenty of time.
Yes, we are agree, yes.
All right. There's more decisiveness there from Saidu Royals. Let's lock it in. Option D, are they right? And again. And again. Real confidence and real knowledge there. Wonderful. Wonderful display by Saidu Royals. So a slog sweep off the spinner and it's gone over the onside boundary for another 6. So wonderful, wonderful play. Next, question 6. Read it out, please. Sheikh Zaid?
Okay, which medication should be considered to further reduce progression of kidney disease beyond ACE inhibitor? Option D is beta blockers and option E is alpha blockers.
I think I'll read it out again because I think we lost something in over the stream. So which medicine or which medication should be considered to further reduce progression of kidney disease beyond ACE inhibitor therapy? Is it A, NSAIDs, B, SGLT2 inhibitor, for example, empagliflozin? Is it C, a DPP4 inhibitor? Is it D, beta blocker? Or is it E, alpha blocker? Start the clock.
Option B, SGLT2 inhibitors.
Once again, within 5 seconds, you've come up with the answer. Is that the opinion of all of you? You all agree?
Yes, yes.
Very certain there. Lock it in. Option B. And they've done it again. They've done it again. This time they've reverse sweeped the ball beyond the keeper. It's gone high in the air and it's missed fine leg and it has gone for another 6. So that is wonderful, wonderful play. That's 6 sixes in a row by Saidu Royals. That is some real pressure when Rahim Yar Khan chased this total. Let's move on to question number 7. Rahim Yar Khan, can you read it out?
Okay, which of the following in diabetic nephropathy? Option A is high protein diet. Option B is low sodium diet. Option C is high sodium diet. Option D, low phosphorus diet only in early stage. Option E is liberal potassium intake.
So which of the following dietary modifications is recommended in diabetic nephropathy? So you've got these 5 options. 52 seconds left.
6 gram.
50 seconds.
Option B, low sodium diet.
Okay, option B, low sodium diet. You were very certain about your previous answers and they were all correct. Are you certain about this?
Yes, yes.
Okay, let's lock in option B again. And again. And again. This is becoming a real wonderful habit by Saidu Royals. Once again, hitting the ball out of the park, out of the stadium for 6 runs. Brilliant. 3 more questions. I'm wondering, are Saidu Royals going to do a perfect 10? Let's see. Question 8.
Presence of which of the following would suggest non-diabetic kidney disease? Number A, diabetic retinopathy. Number B, option B, gradual decline in eGFR. Option C, macroalbuminemia with preserved GFR. Option D, microscopic hematuria with sudden onset proteinuria. Option E is long duration of diabetes before proteinuria.
Clock starts. So which of the following would suggest non-diabetic kidney disease?
Non-diabetic kidney disease.
Suggest कि वो non-diabetic.
Option D, microscopic hematuria and sudden onset proteinuria.
Thank you for clarifying. Option D. So you were decisive before. Are you decisive again?
Yes.
All right. You seem absolutely sure. Let's lock it in. Option D. It's a lock. And again, brilliant. Absolutely brilliant. So the bowler's bowled a full toss down the leg side and you've picked it up and swung your bat hard and it has defeated the fielders and gone for another 6. Brilliant. Brilliant, brilliant play. So 2 more, and I'm wondering now, that landmark of scoring 10 out of 10, that seems within reach. I mean, this could be a perfect score by Saidu Royals, an extremely impressive performance, regardless of what happens next. So question 9, let's see what comes up. Read out the question, please, or I shall. Question 9. What is the recommended frequency of checking urine albumin in patients with diabetes? Is it A, monthly? Is it B, every 3 months? C, every 6 months? D, annually? Or E, every 5 years? The clock starts now.
Option D, annually.
Option D, annually. So is that the opinion of all of you? Are you all sure about this?
Yes.
Everyone's nodding their head. So it's all or nothing. Let's lock in option D, annually. Wonderful, brilliant, brilliant play. So this time they have charged the fast bowler down the pitch and they've smashed it over his head and they smashed it over the field as well. It has smashed into the sight screen and it is gone for another 6. So 9 out of 9. Absolutely devastating answers there. And I'm sure that's put some real pressure on Rahim Yar Khan. And I'm wondering if they can complete the set. Question 10. Let's see if you can do it.
Why is metformin a concern in this patient with eGFR of 58? Number A is causes hypoglycemia and CKD. Option B associated with nephrolithiasis. Option C is increases proteinuria. Option D is risk of lactic acidosis as GFR falls. Option E is causes interstitial nephritis.
Clock starts.
Option D, risk of lactic acidosis as GFR falls.
You decided that within 3 seconds of the clock starting. We have 48 seconds. I just need to be sure because this is your last question. It's all on the line. This is an absolutely legendary performance. You're sure?
Yes.
Lock in option D, risk of lactic acidosis as GFR falls. Lock it in, lock it in. And it's there. It's just brilliant, absolutely brilliant performance by Saidu Royals. I'm sure that your mentor, Professor Dr. Ghulam Fareed, and your coach, Dr. Hafiz Naeem, would be so proud of you right now. I mean, it's an absolutely wonderful performance. I have to react to that.
No, our coach and supervisor are Dr. Mohammad Ayub Khan and Dr. Wasil Khan sahab.
I'm sorry. I'm sorry. We've got Associate Professor Mohammad Ayub Khan and Professor Dr. Wasil Khan. I stand corrected. I'm sorry. The paper I was handed was kind of mixed up. So thank you for clarifying that. You're right again on that as well. So how did you find the questions, and are you happy with your performance?
Yes, we are happy with our performance, and the questions were good, and they will help a lot in patient management and also to understand the cardiometabolic syndrome.
Wonderful. Wonderful. I would like to hear some comments from Professor Muhammad Ishaq, our patron-in-chief, regarding this amazing performance. And
thank you very much, Qurban, for asking me. I was really thrilled and excited to see the performance by Saidu group of hospitals. I must give compliment to the person who has framed the question and the topic that they have selected. Very, very practical, day to day, and the way they have answered with confidence. I'm so happy to see that this league is providing a real stimulus to our youngsters to read and know about these things. Maybe because of this competition, they want to win, they want to be on the horizon. But whatever, I think it's a great academic exercise, and I have really enjoyed every bit of it. I was in the market just before coming to my house at just before 2 o'clock. I'm actually flying tonight to UK and had some shopping, but I rushed to my house to get myself connected with the program. So I think well done. All heads off to the supervisor, the mentor, the trainer, every bit of the people who have contributed in their success. They need to be complimented. And thank you for your excellent moderation. Thank you.
Thank you, Professor Ishaq. Bahut shukriya. Thank you. So, Professor 𝐏𝐚𝐤𝐬𝐿, sir, I'd love to hear your comments as well.
It was really wonderful. I think very, very confident and prompt answers, and all of them correct. So I think couldn't have been better performance. I really love it. And I must compliment the entire team and their coach and their mentors. It was really, really a treat watching this match.
Thank you very much for your kind comments, sir. As Professor 𝐏𝐚𝐤𝐬𝐿 did mention, the answers came so quickly. There was such a degree of confidence, and obviously they've been very, very well trained and taught by their seniors at their institute. Let's move on.
Qurban, मुझे तो लग रहा था कि कहीं पर्चा लीक तो नहीं हो गया. The way they were answering so promptly and so quickly, I say it's amazing, really amazing. I must congratulate them. I've got great love for Swat, where I have my two children married, so I frequently visit their units, and they're doing a wonderful job. Excellent.
Thank you, sir.
That was a wonderful compliment for Saidu Royals. I mean, that was the level of performance that they gave, mashallah. It was wonderful. So with that praise, which is well deserved for the Saidu Royals, we move on to, there is another team in this competition, Sheikh Zayed Hospital from Rahim Yar Khan. They have a tough act to follow. This is one of the best performances I've seen while moderating this program. But Sheikh Zayed have an opportunity. Maybe they can match this, and if they match it, maybe they can better it if they get to the sudden death. So Sheikh Zayed, are you ready?
Yes, we are ready.
Okay, you're gonna have to put in the performance of your lives, but I'm sure you're well up to it, and you're capable of doing it, inshallah. So, Saidu Royals, you performed magnificently while answering your questions. Now I need for you to ask the questions of Sheikh Zayed. Can we have the case history on the screen? There we are. Saidu Royals, read it out, please.
जी A 65-year-old male with a 40-year smoking history, present with progressive exertional dyspnea for the last 6 months. He reports chronic cough with occasional sputum production. He denies chest pain or orthopnea. Physical examination reveals loud P2, jugular venous distension, peripheral edema, and bilateral wheezes. Oxygen saturation on room air is 88%. Chest X-ray shows hyperinflated lungs. Pulmonary function tests show FEV1 ratio FEVC of 55% with reduced DLCO. Echocardiography reveals an estimated pulmonary artery systolic pressure of 55 mm of Hg with right ventricular hypertrophy. A right heart catheterization confirms a mean pulmonary arterial pressure of 30 mm of Hg, pulmonary capillary wedge pressure of 12 mm of Hg.
Did you pick up on that, Sheikh Zaid? Did you hear that clearly and see the case history?
Yes, we have listened and read clearly.
Okay, excellent. So let's move on to question number 1, please. Question 1. Let's read it out, please. Saidu Royals, read it out.
What is the most likely underlying lung disease causing this patient pulmonary hypertension? Option A, idiopathic pulmonary fibrosis. Option B, chronic obstructive pulmonary disease. Option C, sarcoidosis. Option D, asthma. Option E, obstructive sleep apnea.
Let's start the clock.
Option B, chronic obstructive pulmonary disease.
All right.
The answer is
3
option
seconds. 3 seconds. 3 seconds is all it took for you to answer. Register your first answer. This is a critical contest, so are you sure? Is that the opinion of all of you?
Yes, we are sure about option B, chronic obstructive pulmonary disease.
Thank you for clarifying. Let's lock in option B. Let's see. Can they get off to a flyer? They have. They hit the first ball over the bowler's head for 6, slogged it. And it has gone over the long on boundary. So that's the first start. They've taken a bit of pressure off themselves. They're on the right track. Let's move on to question number 2.
According to the WHO classification, which group does this patient pulmonary hypertension fall into? Group A, pulmonary arterial hypertension. Group 2, pulmonary hypertension due to left heart disease. Group 3, pulmonary hypertension due to lung disease or hypoxia. D, Group 4, chronic thromboembolic pulmonary hypertension. E, Group 5, pulmonary hypertension with unclear or multifactorial mechanisms.
Start the clock. So where does it fall into the WHO classification? 5
Option C, Group 3, PH due to lung disease or hypoxia.
So it's option C, Group 3. That's what you've gone for. You've got 45 seconds left. You made your choice very early, so you have time to reconsider. Do you want to reconsider?
Yes, option C, Group 3, PH due to lung disease or hypoxia.
All right, so they're certain about it. They made their choice very quickly once again. Let's go for option C. Lock it in, please. Brilliant. Brilliant. So under pressure, as you always are when you're chasing a big total, they have swept the spinner for another 6. So 2 out of 2. Well done. Still in the hunt. Let's get on to question 3, please.
What is the most important pathophysiologic mechanism of pulmonary hypertension in this patient? Option A, pulmonary artery vasculitis. Option B, hypoxic vasoconstriction. Option C, increased left atrial pressure. Option D, pulmonary embolism. Option E, smooth muscle proliferation due to BMPR2 mutation.
Start the clock. So pathophysiology, what's the mechanism? Can we have Sheikh Zaid on screen, please?
Option B, hypoxic vasoconstriction.
So they've gone for option B. You were conferring. You're agreed on this? Are you sure?
Yes, inshallah.
All right, inshallah. Good thing to say. Let's lock it in. Option B, hypoxic vasoconstriction. Are they right? They are right. They are right, and they are right in the hunt. They're right in this match. They're not out of it yet. They're still fighting. So well done to 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧 𝐂𝐚𝐤𝐬𝐭𝐚𝐧 Protectors. They're protecting their position in this match. Let's move on to question 4.
Which of the following is a hemodynamic definition of pulmonary hypertension per current guidelines? Mean pulmonary arterial pressure greater than 20 mm of Hg. Option B, pulmonary artery systolic pressure greater than 25 mm of Hg. Option C, pulmonary capillary wedge pressure more than 15 mm of Hg. Option D, cardiac output less than 4 liter per minute. Option E, right atrial pressure less than 5 mm of Hg.
A question about hemodynamic definitions of pulmonary hypertension as per the guidelines. You've got 5 options. Half the time has elapsed.
Option B, pulmonary arterial systolic pressure more than 25. B, option B.
Can you keep your microphone on during discussion, please, so we can keep it.
Okay, okay.
Option B, is that the opinion of all of you? You've got 15 seconds. You can change if you want.
No, option B.
All right, so you're definitely sure it's option B. Fine, if you're sure, then we'll lock it in. Option B. So the answer was actually mean pulmonary artery pressure greater than 20 millimeters of mercury. So unfortunately, you got 0 for this. So you left a gap when you were facing the leg spinner, and he bowled a googly, and it whipped off your off bail. So you are now out. You've scored 18 out of a maximum of 24, but that's fine. You're doing a great job for your institution. And I want you to keep on fighting, and I'm sure you will, to get the maximum score possible.
Yes.
Let's move on to question 5.
What key findings distinguishes group 3 pulmonary hypertension from group 2 pulmonary hypertension? Option A, high pulmonary capillary wedge pressure. Option B, normal wedge pressure with evidence of lung disease. Option C, elevated left ventricular end diastolic pressure. Option D, history of systemic hypertension. Option E, elevated pulmonary vascular resistance due to portal hypertension.
Start the clock. Group 3 pulmonary hypertension versus Group 2 pulmonary hypertension. What's the difference?
Option B, normal wedge pressure with evidence of lung disease.
Okay, so you're certain about that? Is that the opinion of all of you? You did confer?
Yes, it is confirmed.
Okay, option B, let's lock that in. Brilliant. Excellent, excellent performance. So even though they're out of this contest, they're still fighting, and they're fighting very hard. They're batting very aggressively. So they have square cut the ball in the air, and it's gone beyond all of the fielders, and it has gone beyond third man as well, and it's gone over the boundary for a sixer. Brilliant. So four correct answers out of 5. In any normal competition, this would have been an excellent score, and they'd still be in this competition, but they're facing very, very tough rivals today. Question 6.
Which of the following therapies is most appropriate as first-line management of this patient pulmonary hypertension? Option A, endothelin receptor antagonist. Option B, supplemental oxygen therapy. Option C, sildenafil. Option D, lung transplantation. And option E, high-dose corticosteroids.
The clock has started. 1 minute. Microphone on, please. Half your time has elapsed, but you still have time. Make sure you get everyone's opinion.
Option B, supplemental oxygen therapy.
Okay, option B. You've got 14 seconds. You can change your mind if you like, but is that your consensus?
No, answer is final.
Okay, option B, supplemental oxygen. Are they right? Are they right? Yes, they're right. Yes, they are right. They're still batting very, very aggressively. They've charged the spinner and they've lofted it over long on for another 6. Brilliant play. Score is now 30. Next question, question 7.
In group 3 pulmonary hypertension, long-term therapy is indicated when resting partial pressure of oxygen is option A more than 70 mm of Hg, option B less than 80 mm of Hg, option C less than 60 mm of Hg, option D less than 88 mm of Hg, and option E less than 75 mm of Hg.
So it's long-term oxygen therapy.
Option C, less than 60 millimeter of
All right,
mercury.
they gave that answer within 3 seconds. Are you guys sure? Are you absolutely sure that you're right?
Qurban, I would suggest that they should take their time. They shouldn't jump on the conclusion.
Wonderful advice from Professor Ishaq, our patron-in-chief. Take your time. Don't just jump on it.
Option C is correct.
But why to wait when you're sure? That reflects your confidence.
Yes.
A counterpoint by
Sometimes
Professor
overconfidence
Aziz
is not
Rahman.
good as well.
Okay, so they're certain, sir. They are absolutely certain it's option C.
Option C.
Option C, let's go for it. Yes, they are correct. They are correct. They had faith, and their faith was rewarded with another correct answer. So the score is 36 out of a maximum of 42. And I have to say, they are an excellent, excellent team.
Yeah.
If they were facing any other opponent, they would be winning this competition. They're winning this contest. Let's move on. Question number 8.
Which of the following is not typically recommended in managing group 3 pulmonary hypertension? Option A, treating the underlying lung disease. Option B, long-term anticoagulation. Option C, smoking cessation. Option D, vaccination against influenza and pneumococcus. Option E, pulmonary rehabilitation.
Remember, this is a negative question. This is a negative question, Sheikh Zaid. So you're going to give the one thing that is not recommended in these 5 things. Sheikh Zaid, on screen, please. Keep your microphones on, Sheikh Zaid. So a bit of consulting going on, a bit of conferring.
Yes.
Dr. Qurban, should we not be listening to their conversation when they're discussing?
Option B, long-term anticoagulation.
We should be listening to their conversation,
Long-term
sir.
anticoagulation, option B.
All right, they've
Option
gone for
B is
option
correct.
B. Can we lock that in?
Option B, yes.
B. They're right. They're absolutely right. They played it to perfection. They have waited for the ball to come in. It's a short-pitched ball, and they have played it beyond the slips, and it's gone in the air, and it's gone beyond all the fielders behind the wicket, and it has gone for 6. Now, the point by Professor Ishaq is absolutely right. We need to know what you're saying. This will enable us to ensure more fairness in the marking. So you must keep your microphone on. You must talk close to the microphone so we know what you're saying. You're performing brilliantly. You're just 2 questions away from a wonderful performance. But you must keep your microphone on so we know what line of reasoning you're pursuing. Question number 9.
What echocardiographic finding is suggestive of right heart strain in this patient? Option A, left atrial enlargement. Option B, aortic stenosis. Option C, right ventricular hypertrophy. Option D, mitral valve prolapse. And option E, left ventricular concentric hypertrophy.
Option C, right ventricular hypertrophy.
That was 1 second, literally one
Yeah.
second before you answered. Now, in the spirit of things, with Professor Ishaq's advice, I would urge you to always consult with your teammates and make sure you're absolutely certain and go through all of the options. Are you
And
certain?
possibly there's no other viable option
Yeah, yeah.
anyway. So that's why.
It was, I think, a low-hanging fruit.
So
It was on the
low-hanging
plate.
fruit.
It was a low-hanging fruit.
So, with those
Option
comments of
C.
our senior mentors, you've gone for option C. Are you sure? Do you want to lock that in?
Yes.
Okay, let's lock that in. Option C. And they're right. You're right again. Such a strong team. Wonderful. Once again, you've charged up the pitch against the fast bowler this time, and you've smashed it over his head for another 6. So that's 8 correct points out of 9. So that's a really, really good score. Very, very competitive score. Last question. Let's see if you can get this one right.
What is the role of right heart catheterization in this patient? Option A, to confirm the diagnosis and assess severity of pulmonary hypertension. Option B, to detect coronary artery disease. Option C, to guide mechanical ventilation. Option D, to measure lung compliance. Option E, to evaluate upper airway obstruction.
Option A, to confirm the diagnosis and assess
So-
severity of pulmonary artery
Okay, so they've gone
hypertension.
for option A within 1 second. Did you consult, Captain? All right. You're all happy with that
Yes,
choice?
to confirm the diagnosis.
All right.
Yes.
Well, if you're right, this is going to be the most legendary contest that I've ever seen in this competition. If you're right, let's see if you are right. They are right. They are right. A truly magnificent performance. They haven't quite made it this time, but they've scored a total of 54. So, no need to feel down. I think your performance is absolutely wonderful. To get 9 questions out of 10, 99% of the time, that's usually enough to get a win or a draw. I think this time you just faced an absolutely outstanding team in the Saidu Royals. I think you should be very, very proud of your performance. Your mentor and your coach and your seniors and your trainers should feel immensely proud of the effort you've put in. Most of the time, what you put up today would be enough to win, and you are one of the best teams that we've seen. It's just unfortunate that you faced someone who on the day performed slightly better. But I have to say, wonderful, wonderful, wonderful performance by both teams. Both teams are winners today. They've demonstrated their knowledge and their judgment and their clinical progression, and I'm sure that all the members of both teams are going to do wonderfully well in the future in their careers. They've got a wonderful platform. So I would like to hear from our patron-in-chief, Ishaq Sahab, if he's available, regarding this contest.
Thank you, Qurban. Another excellent competition. What a wonderful performance by both the teams. As you said, I agree with you. Both are winners. एक गलती जो है वो कोई बहुत बड़ी बात नहीं है, but they have to face Saudis, and Saudis are living in a better climate these days. Cold weather versus the desert of Rabia Khan. Probably they missed one question, but as you said, otherwise, in a standard competition, they would have won, because we hardly see such a 10% result in our previous matches. So I think both teams have done very well. The questions were excellent, and the mentors and the coaches of both the teams deserve our compliments. Of course, Swat is a relatively new center rather than Sheikh Zayed. Professor Rizvi has been there for a long time, and Raimyar Khan is doing very well otherwise in cardiology, and got fond memories of visiting that department many years ago. So I think I would congratulate both the teams. And I was telling one of my niece sitting next to me, I am learning from these answers and questions, and we are refreshing our knowledge and updating ourselves. So I think, on the whole, I must pay my gratitude and compliments to my dear friend Professor Azizur Rahman and all those who have contributed in this academic endeavor. I think this is an excellent way of promoting knowledge, seeking knowledge, learning, and being competitive. So both the teams deserve my congratulations. Swat, very well done. Raimyar Khan, very well done. Excellent on both sides. And thank you for your
Thank you so
excellent
much, sir.
moderation as ever. You see, you
Thank you.
make it so lively and so uh, easy to assimilate and listen to the questions and answers. I think this is wonderful. Well done.
Thank
Thank
you.
you very much for
Thank you.
having
Thank you,
me.
Thank
sir.
you.
Thank you.
Okay.
Thank you so much.
So, Saidu Royals, you won this contest. You performed perfectly, which is something I've rarely seen. But you had very stiff competition. They were chasing. We knew early on that they wouldn't make it, but I think your opponents were quite excellent this time round. Raimyar Khan were excellent. So, any comments
Thank
you'd
you.
like to make about this contest today?
Thank you for giving us a chance for this wonderful activity. I want to say the questions were very clinical in our practice. Very much detailed questions were there.
And Saidu Royals, would you like to say anything about this contest? Or well, I think you should recognize the quality of your opponents as well was very, very high this time round.
Uh, Thank you for giving us this opportunity and arranging such an academic activity. And surely the opponent were very good. एंड ये लोग बहुत अच्छे थे, उन्होंने भी बहुत अच्छा परफॉर्म किया, लेकिन ये एक दो क्वेश्चन जो है ये तो हर किसी से हर वक्त जो है गलत हो सकते हैं, और टुडे वाज आवर डे, सो इंशाल्लाह उनके लिए भी हम दुआ गो है इनको इनकी कामयाबी के लिए, और बेस्ट ऑफ लक
Thank you so
फॉर
much.
देम इन द फ्यूचर.
And congratulations to all of you for the win, for the best win.
थैंक यू जी, थैंक यू.
So
Thank you so
very,
much.
very gracious, both teams with each other. This is the kind of spirit that we like to see. Professor Azizur Rahman, two wonderful teams today. Wonderful performance. Your comments, sir.
Thank you very much. I think I would rate the second team equivalent to the first one, but just
Yes, sir.
unfortunately, they dropped a catch. I think both the teams, they performed very, very superbly, and I must compliment.
Thank
I
you
think
so
both
much.
are winners. And I think it is just, I think, coincidence that both teams are all men teams. I think this is just a coincidence. This was perhaps the best match I ever watched in this series.
That's extremely high praise from Professor Azizur Rahman, who has been here from the very beginning. So that's wonderful
Qurban,
praise.
absence of females resulted in less discussion, you see, and they were very prompt in their answers. Otherwise, when there is female, there's always discussion going on, and
So
sometimes they end up with the wrong answer. So I think
I'm not going
that
to
being a
comment on that,
bias,
sir.
but I think आज का जो experience है with the men only has been more rewarding than a mixed team.
At least it was a
But
fair
don't
match
take it
because
by word,
both teams
please.
were men only.
Wonderful, wonderful.
And I agree
So-
with Rahman Sahab that both teams are at par. एक catch
Definitely.
drop करना कोई बात नहीं है.
Yeah.
कोई
But
बात नहीं.
numerically, of course, we have to follow the system. The Saidu team wins.
Yeah. Sometimes there's a difference of the difficulties in questions also, you see.
Yeah, definitely.
And you can't have both the questions
Yeah.
very much at par. You see, there are maybe some difficult questions in one scenario than the other one. So I think on balance, both teams deserve our compliments.
Very
So
good.
with that, I would like to take your kind permission for the next episode. Allah Hafiz.
Allah Hafiz, sir.
Allah
Thank you very
Thank
much.
you so much.
Thank you. So there we have it. Another team has won this contest. Saidu Royals scored a perfect 10. Their opponents from Raimyar Khan, Raimyar Khan Protectors, performed brilliantly, but they just missed one. just one, and that was enough for them to be knocked out of this competition. But they come out with tremendous credit to their institution, credit to their trainers, their mentors, their coach. They performed brilliantly and they showed tremendous spirit in their defeat. But Saidu Royals are through. Remembering that there are 36 teams and only 6 teams can make it to the Super 6, so Saidu Royals have done everything that they could in order to secure this spot in the Super 6. I wish them the best of luck in the next round, and I want to say to Sheikh Zayed Rahim Yar Khan protectors that they were a real credit, and they'll come back stronger next year, I'm sure. So with that, we are done with this contest. Wonderful competition, wonderful contest today, and we will surely be back with another match. So from me, Dr. Qurban Khan, the host, from Wilson's Pharmaceuticals, it's Allah Hafiz.